Hi, we're Megan and Jillian, and we're going to be presenting on oncology care for patients with glioblastoma during natural disasters and health crises.
Glioblastoma multiforme is a grade 4 fast-forming malignant brain tumor that most often occurs in adults. There are over 100 brain cancers that exist, but what differentiates glioblastomas is that they originate in a specific type of cell, the glial cell, that surround and support neurons in the brain. Glioblastoma also has a very high incurable rate and a very poor prognosis, and the treatments are not as well developed as other hormonal cancers. When natural disasters like power outages and other health crises like COVID strike, it becomes difficult for patients to receive the adequate care they need. There becomes issues with loss of medical records, lack of communication between patients and providers, lack of accessibility to healthcare facilities, and an increased progression of these cancer tumors. In an attempt to mitigate the detrimental effects from natural disasters, pharmacists can educate patients on what vaccines to receive, their increased risk due to immunocompromisation, and guide selection of alternative therapies based on specific patient needs and current regimens. This poster will be focused on what a pharmacist and technician could do to help limit the progressive nature of this disease, particularly when disasters occur, to maintain continuity in oncology care, which is important for glioblastoma patients.
After today's presentation, you should be able to understand the pharmacist's role in the continuity of care during disasters and health crises, and describe areas of glioblastoma care that are affected by disasters and health crises. Before being diagnosed, oftentimes patients experience symptoms like headache, seizures, personality changes, numbness, or speech problems. A lot of the times, the tumor will actually go undiagnosed until the patient goes to the hospital when they're experiencing these side effects. Most often, a treatment regimen will begin with surgery, but cancer cells usually remain after the removal of a tumor. So the patients will require additional treatment like chemo and radiation to kill the leftover cancerous cells. Something to consider before starting a patient on chemo and radiation is the patient's age, performance status, and methylation status. Methylation status refers to DNA methylation, which is a biological process where methyl groups are added to a DNA molecule. Methylation can change the activity of a DNA segment without changing the sequence, and when located in a gene promoter, DNA methylation typically acts to repress gene transcription. Therefore, the methylation status of a patient helps us determine how aggressive we need to be with treatments. If a cancer patient has a lot of DNA methylation events occurring, there is more metastasis and there is a worse prognosis. Performance status tells us how well the patient is able to carry out activities of daily life and is evaluated using a tool called Karnofsky Performance Status. This tool, also called the KPS tool, ranges from a score of 0 to 100, and the higher the score, the better the patient is able to carry out daily activities. Overall, there are 4 most common regimens for glioblastoma treatment. The first regimen is radiation with temozolomide and plus or minus electrical field therapy. This first treatment is the preferred treatment. So temozolomide is the chemotherapy drug, and electric field therapy consists of low-intensity alternating electric fields that slow and reverse tumor growth by interfering with the mitotic process of cancer cells. A second therapy would be just radiation with temozolomide. So this would be just chemo and radiation without any electric field therapy. If the patient is younger than 70 and has a performance score less than 60, this would be a good option. A third regimen would be just chemo only, so only the temozolomide. This would be a good option if patients are greater than 70 and their performance status is greater than 60, or if the patient has a high methylation status and a KPS score less than 60. The last regimen would be radiation with adjunct Lomocytin and temozolomide. This is another chemo and radiation regimen, but this time with 2 chemotherapy agents. So this option will be good for people that have a performance score greater than 60 and age less than or equal to 70, and have a high methylation status. So this is a schematic that shows a patient's regimen based on age, performance status, and methylation. So, for example, a patient is diagnosed, and if you follow on the diagram, if they're less than 70, have a good KPS score, and are considered to be methylated after evaluation, then temozolomide, radiation, and electric field therapy is the recommended regimen. All the patients, regardless of their status, will get an MRI after 2 to 8 weeks and then follow up at various increments.
The Natural Disaster Medical System Federal Partners Memorandum of Agreement defines a public health emergency or health crises as an emergency need for health care services to respond to a disaster, significant outbreak of an infectious disease, bioterrorist attack, or other significant or catastrophic event. By this definition, both natural disasters as well as pandemics are examples of health crises. To differentiate between a natural disaster and a pandemic, a natural disaster includes hurricanes, floods, tornadoes. These are more localized to a certain area and are considered natural events. A pandemic is an infectious disease such as COVID, the flu, the Zika virus that has spread across a large region. This is a worldwide event and it affects an entire country or even the entire world. When thinking of natural disasters, there is a possibility that many things may be lost or destroyed. To start, we may have a loss of access to medical records. This could be in the form of paper copy medical records if they are destroyed, or a loss of power which can affect access to electronic medical records. As a pharmacist, we should educate the patient to write down a comprehensive list of the medications and treatment schedule that they are currently on to have it handy for any accessible healthcare provider. Some of the things they should include is a medication log that lists the type and stage of cancer, the date of their last treatment, the type of treatment and medications they are on, any other medical illnesses that they may have, and emergency contact numbers. Natural disasters can also cause a lack of communication with providers and the patients. This can occur if there's a loss of power and phone lines are down. This will affect the ability to communicate. Writing down that comprehensive list and carrying it with them will help a patient if they need to interact with a different healthcare provider than their normal provider. Disasters can also prolong availability of treatment. This can lead to a loss of control over tumor growth. These patients really cannot go without treatment for a long time. Tumor resistance development may occur. We must try and start therapy as soon as possible because even 1 day breaks can have detrimental effects. Therefore, as a pharmacist, recommending alternative treatment centers will be crucial in cases of natural disasters where there may be damage to the facility or loss of transportation to a certain treatment center. We should also educate the patient on carrying backup accessible charged batteries for portable electrical field therapy caps if this is part of their regimen. We must also counsel them to keep any and all wounds cleaned and covered to prevent the risk of infection. And we should provide them with supportive care and counsel them on any medications such as antiemetics that may be useful before they can get back into a treatment center. Pandemics prove to provide an obstacle when it comes to providing adequate care to the community. This is in the sense that patients will have to communicate with their doctors via telehealth rather than in person, and there could be a lack of supplies, such as vaccines, N95 masks, and sanitary gloves. During pandemics, we can also have a risk of the prolongation until treatment. This can again cause a loss of control over tumor growth. especially during times when we may have stay-at-home orders, such as the quarantine period of COVID. During this time, pharmacists should recommend over-the-counter medications to subdue any side effects, such as nausea and headache, during the lapses of inaccessible chemotherapy or radiation. We also have an infection risk prevention that pharmacists should educate patients on, such as constantly washing their hands, utilizing alcohol hand sanitizers, and drinking only bottled or boiled water. They should also always recommend vaccines that patients need to be up to date on, especially these immunocompromised populations. We should recommend vaccines such as Hep A or Hep B, the flu vaccine, and tetanus. Regarding COVID specifically, a comprehensive evaluation should be done on patients to look at their clinical symptoms, tumor images, molecular testing results, and planned surgery scale and location, in case these become effective. Electrical field therapy can be performed at home with portable devices, so appropriate training for patients and family members should be ensured. Patients can also receive longer month supplies of their medications in case they do not feel comfortable going outside of their house. We should educate patients on maintaining social distancing and wearing their face masks to lower the risk of infections. The risk of COVID is still there, even through sanitation precautions, social distancing, and wearing face masks, so we must educate patients on this risk.
To continue on with the role of the pharmacist, we just wanted to highlight where pharmacists make the most interventions in glioblastoma care. So as shown in Figure 1, about 62% of a pharmacist's role for glioblastoma patients is in the clinical pharmacy setting, and then about 27% is in the outpatient pharmacy, and only 11% is in the chemotherapy pharmacy. Now to focus on the pharmacist's role in health crises, we can start with drug-drug interactions. So it's important for a pharmacist to identify these interactions with their patients so that they're making sure they're receiving safe and efficacious care. It's also important to note that medications like Tylenol, anti-nausea meds, or NSAIDs that patients may take while receiving chemo and radiation do not interact with other medications. A second thing a pharmacist can do in a patient's glioblastoma care is educate the patient. So this goes back to what we talked about could happen with natural disasters and pandemics, but it's important to reiterate that pharmacists should educate patients to keep a log of their medications, or if they're using electric field therapy, to make sure they have backup batteries, and do things like keep wounds clean to avoid infection. A third thing a pharmacist can do is research local resources. So pharmacists should stay up to date on resources in their area that could assist patients during this time. So if a patient has to receive chemo or radiation at another facility, it's important that a pharmacist knows the closest one. Or if a patient has to receive vaccines, it's important that a pharmacist stays up to date on what's available and what they should be receiving. And then lastly, it's important that a pharmacist provides the continuity of care to patients. So they should make sure they're receiving the optimal care that they can, and that they're scheduling follow-up appointments with their physicians.
Since a majority of oncology care is performed in a clinical setting, it is important we also mention the role of pharmacy techs. Pharmacy technicians are in charge of properly preparing hazardous and non-hazardous prescriptions, and they must make sure they are dispensed accurately. They are also in charge of inventory, ordering medicine and supplies, and reconciling invoices as necessary. They maintain electronic health records and must be trained in keeping the environment safe and sterile at all times. This includes proper donning and doffing techniques and maintaining good hygiene, such as clean fingernails, no makeup, no perfume or nail polish, and hair and beards covered at all times. Technicians must also make correct math calculations, as these are extremely important because calculating an incorrect dosage of chemotherapy can cause a patient to receive way too much or way too little of an important medication.
Thank you for watching our presentation on glioblastoma and healthcare crises. If you have any questions, you can send them to our emails on the slide.